Take a look at the parasternal long axis view of the heart in action. Remember again that the most superficial chamber will be the right ventricle, and the normal dimensions of the right ventricle are that it should be about half the size of the left ventricle. If the right ventricle is the same size of the left ventricle, that could be a sign of RV strain. We see the left ventricle posterior to the right ventricle. Note its hypertrophic walls. This patient actually had long-standing hypertension. Let's look at the percentage change from diastole through systole, and here we see that the walls come in well with each heartbeat, indicating good contractility. We see the left atrium to the right of the left ventricle, and notice the mitral valve flipping up and down in between the left atrium and the left ventricle. We see here good movement of the mitral valve, indicating a good amount of blood flowing between the left atrium and the left ventricle. Now, just above the left atrium and to the right of the left ventricle, we see the aortic valve. And notice there, just to the right of the aortic valve, a little bit of the diamond-shaped aortic root. This will be our left ventricular outflow tract. Now, another very important structure to identify on bedside sonography is the descending aorta, which is a cylinder cut in cross-section right below the mitral valve, as seen in this image. This is a very important landmark because the posterior pericardial reflection, that white line seen posterior to the left ventricle, comes off anterior to the descending aorta. This allows us to tell if the fluid that we see there may be pericardial or pleural.